Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Throughout the pandemic, Mary Washington Healthcare leadership has been committed to keeping our community informed. We know that the COVID-19 pandemic continues to raise many questions. Tonight, we're here to share what we know about COVID-19 in our region and what we can do to keep everyone safe and healthy. During this town hall, you'll hear from our expert panelists, and we welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, President and Chief Executive Officer. Next, we have Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer. And finally, we have Eileen Doman, Chief Nursing Officer. Dr. McDermott, I'll turn it over to you to start our program and tell our viewers about the latest information in our region.
Thank you very much, Emily. And first, Happy New Year's to everybody. Here we are entering into 2022. And, to be honest with you, I didn't expect that we'd be having these community town halls talking about COVID-19 as we entered into 2022. Even if you'd asked me last summer, would we be having a town hall like this 6 months from now? I would have said no way. But from that point in time in the summer, the Delta wave that we had, and then now, just in this last short time frame, the Omicron wave that we have coming through with these variants has caused us to want to get together and speak to our community and bring everybody up to speed with what's happening on the healthcare system. And what's happening with this Omicron wave and the increased pressure on our system is happening at a time when we're also having a lot of issues having the appropriate clinical staffing in hospitals. That's not an issue unique to Mary Washington Healthcare. Every single hospital and health system around the country is facing this staffing crisis of having the proper clinical care teams to care for their communities. And so this Omicron wave that we're having is putting a lot of pressure on us. In the past couple of days, it has been compounded by this winter storm that has really just put extraordinary pressure on our health system. And so I think all three of us are here a little humbly tonight to talk to you about the pressures that our healthcare system is currently under here in our Fredericksburg region with this constellation of factors that is just happening right now at the current moment. Let's talk a little bit about the Omicron wave or the COVID-19 pressures on our health system. We've been sharing a graphic throughout the pandemic. I know there's a lot of lines here, but I want to focus you on the yellow line. All the way on the left side of the chart is back at the beginning of the pandemic. It's March 2020 on the left side. And the far right side of the chart is today. And the yellow line is the number of inpatients that we've had hospitalized for COVID-19. I know there's been a lot of with and for conversation going on out there in the internet the past few days, but our number is confidently largely a for number, and I'll talk a little bit more specifically about that, but for COVID-19. And you can see we had a peak back in January of last year, January 2021, about this time. We were up at about 100 inpatients. And today we have 120 inpatients who are currently hospitalized for COVID-19. It's been as high as I believe almost 140 patients in the last couple of days. There's variability at any given point in time. But we're hovering somewhere here about 120 to 140 inpatients that we're caring for. The orange line on the graph is with the scale over to the right x-axis there. That's the number of patients hospitalized in the state of Virginia on any given day. And you can see our experience very closely mirrors the state, but the state numbers are also going up dramatically here. All of this, what's happened really from mid-December until now, rapid increase in hospitalizations. There's been a lot of talk out there about Omicron and whether or not it is more mild. And some of you are probably seeing those news stories about, well, Omicron is more mild. Well, it's also more contagious. And there's never been more infected individuals with COVID-19 in the United States of America than there are right now, which is pretty amazing 2 years into a pandemic. But more people have COVID-19 now than at any other point in time of the pandemic. And so even though it might be more mild, just the amount of people that have COVID-19, a certain percentage of them are going to require hospitalization and need that hospitalized care. And that is what is putting this extraordinary stress on our system. It's just the amount of people that have COVID-19, a certain percentage are going to need hospitalization to help them battle it. And it is putting an extraordinary stress on our system at this point in time. There's another graphic that we've been sharing. We've been sharing this really for the past several months, talking about the importance of vaccination. And it shows how many of our patients have been vaccinated or are not vaccinated. And then we also are able to determine to some degree of certainty those who have been boosted as well. And that you can see here on the chart. There's a lot, some people are looking at this chart and saying like, oh, look at how many green vaccinated folks are being hospitalized. But you have to remember, in the state of Virginia, about 80% of Virginians 18 and older have been vaccinated, right? And so you would expect 80% of this chart to be green if the vaccine wasn't having any protection. So I think this chart shows that the vaccines are extraordinarily protective. It also shows how protective the boosters are. And there's a lot of people talking about the booster shots and if there's a booster needed, it's obvious that the vaccines aren't working. But no, it's just like many other vaccines that we have. The vaccines are like a memory, right? And they show our body a picture of COVID-19. And over time, our memory might fade. It's think of it like almost seeing a picture of COVID-19. Our bodies see that picture. And over time, they say, wait, how many spikes did it have on it? What did it look like? And so getting a booster is just showing our bodies the picture again, refreshing our memories. It's the same thing that we do with tetanus shots and lots of other vaccines that we receive over time. The influenza vaccine that we get every year to boost our memories for what strains of influenza are coming in the coming year. This idea of boosters and needing to refresh the memories of our immune system of how to fight COVID-19 is not new, and it's not unusual. And the boosters will refresh the body's memory, prepare it to help fight COVID-19. And if you do happen to catch COVID-19, hopefully you have a more mild case. There are breakthrough infections. The vaccines aren't meant to be perfect in preventing every infection, but if you do catch COVID-19, they help that case be more mild, hopefully, because your body is more prepared to fight it. And so these are some of the things that we're seeing now currently at Mary Washington Healthcare with our COVID-19 and this Omicron phase that is kind of working its way through. I wish I could say that we are at the peak of it, but I do think the holiday surge is still ahead of us. All the meetings that we had and the groupings with families and loved ones that happened with Christmas and New Year's Eve. A lot of the New Year's Eve folks are just turning positive right now, and their symptoms won't worsen to require hospitalization for maybe another 10 days or so, typically, maybe 2 weeks. And that's when they seek hospitalization. So I think a lot of the holiday surge, unfortunately, is still ahead of us. I hope it's not, but I fear that it likely is. And so we are under extraordinary pressure as a health system. And I just ask everybody a couple of things I would like to bring up. Please don't come to the emergency room for testing if you have mild symptoms. If you have mild symptoms of a respiratory condition, it most likely is the Omicron variant of COVID-19. And so if you can't find an antigen test, I wish they were more widely available too. I don't know why they're not at this point in time. I wish the antigen tests, those kind of lateral flow assay tests that you can get at pharmacies, they should be more widely available. And I wish that they were, because I do think that they play a role. But if you don't have access to one of those, please don't come to the emergency room or even an urgent care center seeking to have a test done. You need to try and find another way to get tested if you feel like you need a test. The Rappahannock Area Health District testing sites, or trying to find one of those antigen tests from family, friends, or a pharmacy when they come into stock is the most appropriate way to get tested. We need to reserve our emergency room for those patients who are having true medical emergencies. And if you're having a true medical emergency, please seek care at one of our emergency rooms. If it's not a true medical emergency and you can seek care through your primary care doctor or some other site of care, I encourage you to help us decompress our health system by receiving that care at that alternative appropriate site for care.
Thank you, Dr. Mcdermott. That's great information for our community, and also a very sobering message to know that that holiday surge is forthcoming, most likely. Well, we will continue to update that graphic, that last graphic that we had up on the screen, and we have been sharing that graphic on our Facebook page pretty regularly over the last several months. One question that has come up from members of our community about that graphic is if there's a difference in acuity of disease between those vaccinated patients who are in the hospital and those who are unvaccinated. Dr. Newman, could you speak to that for our community?
In general, the unvaccinated have the worst outcomes, the highest rates of death, highest rates of ending up into the ICU. That being said, individual patients are individual patients. We have boosted patients who are on active chemotherapy and are highly immune compromised, and they struggle with COVID too, despite vaccinations and boosters. So there's a whole range, and it depends on what people's underlying conditions are. Are they immunocompetent or immunocompromised? But in general, there's no question that the unvaccinated are faring far, far worse than the vaccinated.
Thank you, Dr. Newman. Some other comments and questions that we've received from our community are about monoclonal antibodies. And we've had a monoclonal antibody clinic for a good part of the pandemic and given treatment to many people to help prevent severe illness and hospitalization. And we recently had to temporarily put a hold on those treatments. Dr. Newman, can you talk to our community a little bit about that pause and what will come next in terms of outpatient treatment for COVID-19?
Yeah, the monoclonal antibodies, very proud of the program here at Mary Washington. We were an earlier adopter, and we really probably prevented countless hospitalizations and deaths from COVID thus far. Unfortunately, this very potent therapeutic in our armamentarium is no longer effective. So the way it worked, the federal government had the supply of monoclonal antibodies. They allocated it to individual states, and those states then subsequently allocated it to the health systems and infusion clinics to proceed. All that has been suspended because those monoclonal antibodies are not effective against Omicron. So they're no longer effective. There is a monoclonal antibody called sotrovimab that is effective against Omicron, but it's in extremely scarce supply at this point. It is still being allocated in the same way through the federal governments to the states and to the health systems, but we are only getting very, very small amounts of this medication. It is subsequently being reserved at this point, given the supply, only for people who are critically immunocompromised. We're calling them tier 1 patients, but these are people people who are have a transplant, HIV, some people who are on chemotherapy, as I said earlier. So just critically immunocompromised patients at this point because of the very, very limited supply. As that supply increases, we will ramp up the program. But right now, with thousands of people testing positive in our region, the demand for these therapeutics far, far exceeds any ability that we would have.
Thank you, Dr. Newman. Along the lines of treating COVID-19, members of our community are curious about what treatments we use for patients who are in the hospital, and also the length of stay for patients in the hospital who are battling COVID-19. Dr. Newman, is that also something that you can speak to?
Yeah, so we continuously are trying to follow the science and the best practices as to what are the best therapeutics, whether people would benefit from antiviral therapies, steroid therapies, what levels of supportive care, when to ventilate a patient. So that is fluid, and our physicians and our clinical teams are following best practice guidelines. Some of this is unfortunately down to availability of drugs as well. So whenever we have to factor some of those kind of things in as well. The length of stay thus far has averaged, and it's a wide range, but probably averaged over 10 days for your typical COVID patient. Most people, when they're hospitalized with an illness, are here 3 to 4 days. That's pretty typical. COVID is much, much longer than that, 10 days. And some of our critically ill patients in the ICU have been here for very, very long times, often before they even succumb to the illness. So there's a lot of variability in the range of length of stay, but COVID patients are much longer.
Thank you, Dr. Newman. So we've talked about treatment of COVID-19 in inpatient and outpatient settings. And of course, protecting yourself against the virus in the first place is key. So we've talked about vaccines and encouraging boosters. But when it comes down to masking, it's one of the basic steps that we can take. What kind of mask should someone wear to best protect themselves and others against this new variant?
Well, there's two things to think about with masking, and that is the fit of the mask, how well the mask fits, and how well it filters, the filtration level of the mask. When people ask about masking, it's the best mask you can possibly source. Omicron is far more contagious than what we've dealt with previously with COVID thus far. So the highest quality mask you can get, the better. The CDC even is now talking about a double masking with a surgical mask with a cloth mask over that to add that added layer of protection. But there are level 3 masks that we're wearing in the hospital, which have a very good fit and a level of filtration. Those caring for COVID patients are using fit-tested N95 masks. And then many people in the community are using KN95 masks if you can be sure that you're getting that supplied from a reputable source. But low quality cloth masks are not the best if you can source something better.
Thank you, Dr. Newman. We've had some social media posts come up over the last couple of weeks, and I can see some questions here in our chat tonight, touting the benefits of natural immunity as a defense against COVID-19, whether it's a healthy lifestyle, healthy eating, exercising, or just by virtue of having had COVID-19 in the past. Are these claims supported by science, Dr. Newman, Dr. McDermott?
Yeah, well, people are getting COVID multiple times. They're anecdotally, even here in the community, we've seen people third go around with COVID. So unfortunately, natural immunity is not long lasting. And as a new variant comes out, it can be slightly different and still reinfect somebody. So we also have to be cautious with vaccines. These are all new. The durability of the vaccination and the immunity from vaccines is still an unknown. That's why we're recommending boosters at the 6-month period. And some of this is going to be fluid, and we have to be just live with this uncertainty and follow the data as it comes out. There's no question that you do get immunity from having gotten COVID, but that is no replacement for vaccination. That is not a safe thing to do, and it is not a durable or lasting immunity that you can count on at any point at this point. I think.
And the concept that I'm healthy and I take care of my body and my immune system will prevent me from catching COVID is just not valid. And it's the same sort of thing if you had a patient or a person with tuberculosis and you thought that your immune system was going to somehow prevent you from getting it, would you go in close contact with them and do those sort of things without protecting yourself? You would catch tuberculosis. I don't care what immune system you have. Like, you will catch COVID if you're in the appropriate environment with the right dosage. You will come down with COVID. And once you have it, you're taking a dice roll as to what your course will be when you catch COVID-19. And we've had very young, healthy individuals have very, very serious disease and even pass away from COVID-19. And so you are taking a dice roll. One way you can prepare your body and show it a memory of how to fight COVID-19 is to get vaccinated. And then after a period of time, get boosted if you're eligible for the booster. That's the best way you can have your body's immune system be ready to fight COVID-19.
Thank you for that clarification for our community. Eileen, we've got a question for you just about the outpouring of support from our community, and people are concerned about our caregivers. They want to make sure that our caregivers are not feeling burned out And they also want to know if we have volunteers available to help our teams in the hospital, if meals can be sent in for our associates who are working long shifts or even double shifts. Can you talk a little bit about what's happening with our care teams?
Sure. Emily, I'd like to tell you that our care teams are great and they're, handling things very well. They are burnt out. They're tired. This is 2 years of dealing with this, and it is very difficult day in and day out. So we're very definitely seeing signs of significant burnout among our providers and our clinicians. And we work very hard to try to do the very best that we can to help support them and to help address that. But I will tell you, community support is a wonderful thing, and it is uplifting. So certainly if there are members of our community that would like to do things to help, I think our recommendation is going to be to contact us on our Facebook page, and we can share some of those ideas with you. But it is extremely difficult for our staff. Our clinical staff and providers in the ICU have been taking care of the sickest of COVID patients for 2 years. And now to have the volume going way up. I mean, you saw what those volume numbers look like. It's more than double, what we've typically, seen with COVID. So, we're having to have more staff taking care of COVID patients, more places where we have COVID patients. It's just, it's been a long time. And I think that the best thing that our community can do, and Mike started us off tonight with this, is help support us, is make sure you're using the health system for what we can do for you. And that is, when you have a medical emergency, come to the emergency department. But if it's not a medical emergency, there's other places that you can get care. And we're not telling you that we don't want you, but we're trying to say we've got, some scarce resources, and we want to make sure that we can do the very best for the sickest people in our community. And if you know someone that hasn't been vaccinated, encourage them to get vaccinated. This is a long time. 2 years is a long time. And now here we are in winter, and this weekend with the winter storm, it's insult to injury. And so, we have a very precious resource called our associates, our clinical staff, and our providers. They're doing an excellent job caring for our community, and we need our community to help care for them.
Thank you so much, Eileen. Many people in our community, unfortunately, are still without power or not able to leave their homes because of this inclement weather that we've had this week. And folks are wondering if our health system has been affected by the weather and how we are preparing for potentially more bad weather headed our way tomorrow. Dr. McDermott, is that something that you can speak to?
Yeah, well, I'll just say that this winter storm that came through and shut down I-95, we know how unprecedented that was, and we know how difficult it was to travel or even move through our community with the downed trees and the closed roads and everything. And obviously it affected our health system in a dramatic way. Many of our staff were not able to get into the hospital to help us care for patients. We had staff here in the hospital who have stayed here for long periods of time, over a day here at the hospital. I will just say, I've never been prouder of our healthcare system and our team than over the past few days. Everybody stepping up to make sure we're able to give the best care we can give to our community during an extremely trying time for our health system. And these past couple of days have been absolutely extraordinary. It's not just unique to Mary Washington Healthcare, what's happening in the state. The winter storm, I think, affected us worse than many other areas of the state. But what's happening through the state right now is the capacity of inpatient care is being pressured just about everywhere in the state. And we use different terms when we talk about this. There's a conventional level of care that we give during normal times, right? Conventional standards of care. When that's breached because you don't have the appropriate staffing or resources to care for the demands in your community, you move to what are called contingency levels of care. And then after that, when it's breached even more, you get to crisis standards of care. And we are currently talking here in the state and in our region about these moves from conventional levels of care to contingency and eventually crisis standards of care. And that is a worrying time. And it's why our plea is to the community: help us decompress our healthcare system at a time of extraordinary pressure, and make sure you are only using our system for true medical emergencies and the care that's required at this time to help us preserve the capacity to care for everybody in our community that needs it.
Thank you, Dr. McDermott. We've got some other questions out in our community about boosters. So folks are wondering how long a booster lasts. Do we anticipate needing at least one or maybe more boosters per year? Or even waiting to get a booster after having had COVID. So Dr. Newman, is that something that you can share with our community?
Yeah, I'm certainly happy to answer that question. I think the science and the data is still out on this. It's very early and it's something that's being followed. So certainly there is concern about how long the durability of the boosters will be. Previously, even last year, we talked about, is this going to be an annual vaccine, or how often are we going to need to be a vaccine against it? All that remains unclear. Sometimes, as Mike said, you get a course of a vaccine and then you get a booster down the road, and that second look at the antigen or the virus gives you a durable immunity that will last for a long, long period of time. But sometimes it doesn't, or sometimes viruses change over time. And like the flu vaccine, we have a different flu vaccine that comes out every year. So it is very early to say. Omicron, the old playbook with COVID, Omicron really threw a lot of those kind of conventional things that we had been doing out, masking, social distancing. Really, people who are vaccinated, I'm concerned, are out there feeling bulletproof, but we are seeing breakthrough cases, and people, particularly if you have some risk factors or you're over the age of 65, you should be being very careful at this point. You don't feel bulletproof like we did with Delta. The vaccines worked extremely well against Delta. And if you've been 6 months out from your last dose of your vaccine, you should definitely get boosted if you're over the age of 18, and particularly if you have any pre-existing conditions. There's no question that you should get boosted to help. But as far as the long, durability of these vaccines, we don't know. And the same thing, as I said, with natural immunity, it's not durable either.
Thank you, Dr. Newman. You mentioned earlier, that symptoms with the Omicron variant are typically more mild. And some folks in our audience tonight are wondering if the nature of this variant means that the virus is getting near the end of its life cycle. Is that something that you can comment on?
Yeah, I don't know that that's true. Mike, I don't know if you want to comment on that too, I see, but I don't know that that's necessarily true. Again, this is one of those uncertainties. Will there be further variants or not? But I don't think that this means the end is definitively in sight because of Omicron.
Yeah, I agree with that. And this idea that it is milder and more contagious, that word milder, I don't like people talking about that, because look at the inpatient volume that we are seeing with the Omicron variant. And there's so many people asking questions about, well, how many are Omicron? How many are Delta, right? And we don't phenotype test every single patient for COVID-19. That's the specific testing that's done to say what variant it is, but that's done at a state level. And we know very rapidly almost everyone coming through now is Omicron, right? So, and we know because of the contagiousness of Omicron, just about every case we're caring for likely is Omicron, the Omicron variant. It has become the dominant variant by far very, very quickly because of how contagious it is. And even though it might just be a tad more less severe, okay, the number of patients that have it and the number that end up needing hospitalization obviously is very high, because we have more inpatients right now with COVID-19 than we've had at any time of the pandemic. And so it's not like you're going to just catch this Omicron and everything's going to be hunky-dory. And you're not going to have any issues with that. You need to do the things that you can do to protect yourself the best you can. That is to be fully vaccinated and boosted if you're more than 6 months out from your initial vaccine cycle. And those are the things that are going to give you the best chances of having a mild case if you do come down with the Omicron variant of COVID-19.
Thank you. We have several people in the audience tonight. It sounds like they are parents and teachers who are concerned about kids going back to school. And Dr. Newman, I know that you've spoken in past town halls about the healthiest and safe ways to send kids back to school. Could you share some of those tips with our community?
Yeah, again, as we've seen a very high risk of kids not being in school. So I will start with that. So it's not, keeping kids at home or virtual learning is not a no risk option. There's a lot of risk with that. And it's important for kids to receive, learning at school. That being said, I am personally concerned about Omicron. I think there's a lot we don't know about this. It's much more transmissible, and standard cloth masking and some of those kind of things. This could be problematic. Schools that have already gone back, we are seeing large outbreaks within schools. The good news is, for the most part, again, children are not severely affected. The concern is transmitting to somebody at home that maybe has one of those pre-existing conditions. Of course, there's a whole host of things. But I am concerned. I do know our public health officials in the state have been working very, very closely with the schools. They're going to be as cautious as possible. But, as a parent, if you can get them the pediatric KN95 masks, or a highest quality mask you can source for your child, is going to be important. Do not send your child to school if they have the sniffles, if they're sick. More than 50% of our testing in the health system over the last few weeks has been positive for COVID. So if you have respiratory symptoms, you are likely to have COVID. You don't really need that test to tell you that. So keep your child home so they don't go and infect others. But it is going to be we're going to be watching it very closely as schools resume. And this snowstorm may have been a bit of a relief with the kids not going back this week following all the holidays. So that may, be a blessing in disguise, as terrible as this event was for our region.
Thank you, Dr. Newman. Dr. McDermott, earlier you spoke about, the right time and the right place to seek care. That if anyone who's sick doesn't have critical symptoms, that they should stay home or consult their physician about their next steps. Some folks out there are wondering, when is the time to seek medical care, to either go to an urgent care or potentially go to our emergency department?
Yeah, well, if you can weather COVID-19 and the symptoms that you're having at home, that is appropriate. If you have access to a pulse oximeter, a lot of those are available now, that you can monitor your oxygen levels. If your oxygen levels remain high, there's no really reason for you to seek care. If you feel like you're having symptoms to a point in time where you need supportive care, I think most of us know when that is. When I cannot battle this alone, I think I need more help. That's when you would come in and seek care in our emergency department, right? But if you're able to battle this respiratory illness at home, like you would normally battle the flu and other sort of things, you need to do that at home with the supportive measures that you have at home. It's really, the hospitalizations are for patients that require oxygen to keep their oxygen levels up. Those are the sort of things that that our hospitalized patients with COVID require. Chris, you can add to that, or
no? That's right. We said, we don't have the monoclonal antibody. Before, we would like to get testing and see individuals so we can get them monoclonal antibody. There may be upcoming antiviral drugs. I'm not sure what the supply in the next few weeks is going to be of that. But at this point, we don't have a lot at this point. If you're mildly ill, we can only treat if you're very seriously ill at the hospital. And we are overwhelmed at this point, really. So if you have milder symptoms, it's best to ride it out at home. And if things worsen, then come at that point. There's a lot of questions here, I think, about vitamin D, vitamin C, zinc, and all that. First, I will say none of that is a substitute for vaccination. So none of that is. There have been very modest studies that show some benefits in respiratory illnesses in general with some of that. There's certainly no harm with taking it. But these are not magic. They're not going to prevent you from getting critically ill if you're unvaccinated. But certainly no risk in taking that. Maybe some very mild benefit. And being healthy, it obviously exercising, maintaining a normal weight, all those things predict a better outcome if you do come down with COVID. But as Mike said earlier, it is a bit of a Russian roulette. We've seen young, healthy people die of COVID. So again, that is no way to say, I'm young, I'm healthy, I'm an athlete. I don't need to get a vaccine. I don't need to be social distance. I don't have to be careful, because that is not true.
Thank you, Dr. Newman. We have a follow-up question. As Dr. McDermott mentioned, pulse oximeter. Some folks are wondering, what is that acceptable oxygen level and when should you be concerned?
I would say when you're getting below 87%, that may be the time that you want to come in and get evaluated. Normal is really 95, 96, 97%. So higher. If you are getting below 90% and you have serious medical problems, then you may want to consider coming in and seeking treatment. But if you're a younger, healthy individual, I would probably wait until you got under 87% before really seeking medical treatment.
Thank you, Dr. Newman. We have a couple of folks out in our audience tonight who are recalling when we changed a level of our parking garage into a field hospital, and they're wondering if that area will be activated. Dr. Newman or Dr. McDermott, are there plans in the works to activate that area if needed?
We do have that facility. The issue for us right now is staffing, right? We do not have extra staff, or even trying to mobilize staff to use that for some sort of triage or treatment area. To just be honest with you, we don't have the staffing available to try and mobilize that area at this point in time. That space is still there. We still have it. There are a couple of use cases for it that we've been talking about as a team to help, where we might need to expand into that sort of space. But really talking about having some sort of a testing effort or something like that, we don't have the staff to run a mass testing center for our community right now. All of our staff are caring for hospitalized inpatients in our acute care facilities.
A lot of questions I see about elective procedures, scheduled procedures, et cetera. So since the state, held that very early in the pandemic, we have not blanket canceled elective procedures or scheduled procedures. All these procedures are medically necessary for patients. At times, and at this point, really for the last several months, we've been looking at those cases on a day-to-day basis and seeing what is our current capacity for the day, for the week, and what are the most medically necessary to proceed based upon staffing issues, based upon our capacity in the hospital. The cases that we're looking at the closest are the ones that require hospitalization after your procedure. So those are the ones really based upon the situation at the time that can get delayed. Of course, some of those procedures are the ones that are the most medically necessary too. So this has been very, very difficult, but we have medical staff, leadership, physicians, nurses, others looking at that list on a day-to-day basis and doing everything we can to make sure everyone gets care. But this whole situation is exceeding our capacity to care for people like we would like to. We would never want to withhold any kind of treatment for anybody if possible, but we are being overwhelmed.
Thank you, Dr. Newman. We are coming up at the top of our time for this evening. I think we have time for just a couple more questions. One question from our community is about quarantine period. So if someone has an active case of COVID-19 or suspected case of COVID-19, how long should they quarantine before going back to school or work or being with friends or family?
People are most contagious 2 days prior to having symptoms, which is why this is continuing to transmit so readily, and roughly about 3 to 4 days after they start being symptomatic. And with Omicron, that appears to be the case. If you are symptom-free or mostly symptom-free by day 5, it's felt that your transmissibility drops down significantly. And then with masking for the next 5 days, you can re-enter society, come back to work. The CDC has talked a little bit about testing at day 5, and that would be an antigen test, not a PCR test. PCR test can remain positive for a very long time after infection. So it would be an antigen test. But everybody knows there's a significant lack of availability at this time. That's not practical or possible. And don't come to our emergency room on day 5 to see if COVID is gone, because we have just no ability. We're struggling to care for the people who are very ill.
Thank you, Dr. Newman. And finally, members of our community are wondering if we're seeing any supply chain shortages again. Early in the pandemic, we had a hard time sourcing masks, and we had an outpouring of support from our community with homemade masks. Are there any additional concerns about PPE shortages or shortages of other supplies?
Supply chain issues have been continuous throughout. We talked a lot about the life-saving PPE for our caregivers at the beginning, but it seems like every month something is in critical supply. 2 things at this point that I think are very critical. One is the blood supply. That is very, very short supply across the country, and that's a very significant thing. The other is surgical gloves. That is a new recent one where there's a nationwide shortage of the sterile procedural gloves to do surgery. This is not standard gloves. And teams are working very hard to preserve our supply and, source the gloves as we can. But it seems like every week there's something, not just in healthcare, across life. So.
Absolutely. We know that, those at-home testing kits are
Yeah,
sold out in a lot of places. So, supply chain issues are everywhere. Well, we are at the top of our time for this evening, and so I'd like to turn it over to our panelists to share just any closing thoughts with our community. Eileen, would you like to start us out?
Sure. I'd just like to thank all of our associates at Mary Washington Healthcare, particularly our clinical staff and our providers, for being here every day. And over the last several days with this latest weather event, thank you so much for everything. As Mike said earlier, we had many people who stayed in the buildings more than 24 hours taking care of patients because the staff coming in to relieve them couldn't get in because of the conditions of the roads. We have another weather event threatening us the end of this week. And we're preparing, to make sure that we have staff in our buildings, have people come in early and be ready to be able to take care of patients. But from the bottom of my heart, just a huge thank you to every one of our associates that's been so critical over this past week, but through all of the pandemic. Thank you.
Thank you, Eileen. Dr. Newman?
Yeah, I would just say Omicron is very, very different. This is highly, highly contagious. The standard things we talked about, which would like a cloth mask and 15 minutes and 6 feet of distance, even vaccination is not the same as it was previous in the pandemic. So if you have any significant risk factors, don't assume you're bulletproof and go out into society without a mask or without a high quality mask, or think I was vaccinated 9 months ago, I'm going to be fine. That's not necessarily the case. As Mike said earlier, it is true that this does appear to be a little less severe in whole, but since it's so much more contagious and 4- and 5-fold as many people are getting sick, our health system is being overwhelmed worse than any time in the entire pandemic. So please be safe and don't assume, because you're wearing a mask or you're vaccinated that you're safe, because it's not true.
Thank you, Dr. Newman. And finally, Dr. McDermott.
I'd just like to, I'll start by thanking everybody who's tuned in tonight, all the members of the community who have an interest. We really appreciate your interest. Help us spread the word about the current state of the healthcare system to your friends around our Fredericksburg area. But I appreciate everybody's interest in tuning into our town hall tonight. And I just want to finish by, again, just thanking all of our associates that are part of our Mary Washington healthcare team. They really are healthcare heroes and heroes for our community. And I know everybody's been working under extraordinary pressure. This new COVID surge and the winter storm have not helped at all. But I just admire all of our associates and their attitude and their spirit of coming in here every day, knowing that they want to do everything they can to keep our community as healthy as they can and make people healthier. it really is inspirational. I just want to thank all of our Mary Washington Healthcare associates. I'm proud to be a part of this amazing team here.
Thank you, Dr. McDermott, and to our entire panel for sharing your time and your expertise tonight. And a huge thank you goes out to you, our community members, for tuning in. We do want to leave you with some important information tonight. If you are looking for a COVID test, the Rappahannock Area Health District has a number of events coming up, and we have those here on your screen. You can scan that QR code to pre-register, which is recommended but not required. And if you are still looking for a vaccine, or perhaps you're due for your booster, the Rappahannock Area Health District also offers vaccine clinics locally, and that information is available on your screen now. If you missed some of tonight's town hall, you can watch this recording on our Facebook page or on the official Mary Washington Healthcare YouTube channel. And please be sure to share this recording with your friends, family, colleagues, so that they can be informed of what's happening in our community. We wish you the very best. We hope you stay safe and healthy, and have a good night.